Tamanna. Tamanna, over to you. Please do.
So talking about performance-based checklist or performance-based tests, so they help us to understand about where the child is currently at, and it's basically done by giving the child some tasks to complete that demonstrate their skills, and then we have an end result for it, and then we score this against a set of criteria. So basically, why do we choose performance-based tests when we want to determine what is the current language age of the child, when we want to plan either short-term or long-term intervention, we want to reevaluate how much progress has the child made in therapy, or we want to directly assess the functional capacity of the child. This is a very good standardized administration, and it also gives us a score, which again gives us good reliability.
Now you have to work on that particular area as a goal for the child. So that is another advantage of this test. And just a minute, I would like to summarize how a clinician should be able to do this, very easily. One is use this test on normal children, say about 5 children in your area, in your building, neighbor children. That will help you to get familiarized with the items. And then you should be able to do tests on children who have come to your clinic. Because once you're familiar with the items, you don't have to look into the booklet, you just use a few items ready, keep it ready for your testing, and you are done. And then I think we'll discuss this a little more in detail later on.
In the Maharashtra Marathi kids with DSL or HI or ND, neurodivergent kids, the reliability is very high, and it is very easy to trace the like over a time trace the child's growth. And they have given you the templates also to mark pre and post therapy. Sanghi ma'am is showing you the kit.
Put you the back.
So, and another plus point in MTCDM is they have given you a separate booklet in Marathi. So you don't have to translate on your own and talk about it. So when you are using Reels, you have to translate that in your original language. But MTCDM has given you in the Marathi. So it's more reliable, I feel. And it is very practical to use in the clinics.
How and now nobody is using Reels because it become very outdated. So everybody is into Reels 3. That's one thing. Now coming back to checklist, either it can be observed or self-reported, right? Observation can be from the parent's point of view or from the clinician point of view, and self-reported checklist are the ones where the patient or client, whatever you call, can just fill the form and tell you about a particular behavior being present or absent or user scale. So what happens is checklist, the primary part is training is very, very, very important. As Maya Sanghi madam told, training means getting familiarized because not all tests are alike. So getting familiarized with the test items is very important for you to become confident and for how to proceed through the entire assessment. It is very important that you run through the test in normal and then actually go to your clinical population. That's one thing. Or there are many tests and observe it face to face with the child to know actually what, because we know that the parents sometimes are over exaggerating or sometimes underestimating the child. I need the true picture. I have to have the vision that whether the parent is trying to protect the child, because it's not their fault. It's their child. Their possessiveness is always there. So maximum you have to ask from question point of view, but having said that, you also have to cross check. But because this is observation, that's what I'm trying to make you understand. Because this is observation, you cannot intervene during the observation. It has to be in a free play, scenario. The moment the child comes inside, give them, what I preferably do in the clinical setting is I have a separate almirah, which is open in nature. It's open. So the child comes inside and being a child, he will try to fidget with all the toys. The moment he does, I start interacting with the parents. I do not want the parents also to intervene in between. I myself also do not intervene.
It's quite high due to the toy kit. So that is something like, becomes easier for us to assess the child, those who are like, quite younger, also like 3 years, 4 years. So that is quite a benefit of this test. And the picture tests are, as shown in the picture, they're quite colorful also and very descriptive also. So like, that gives nice engagement from the child again. So this is what I like about this test, and why we chose this test for our setup is basically a school is it requires English medium for the instruction, and we were looking for a test which were which could give us some standardized testing in that covers English syntax and use of language. So a lot of areas are covered with small items in this test. At the same time, expressive communication looks into vocal development. So as it starts from birth, so even the babbling, cooing, everything is it comes into the items. Social communication, the naming, use of specific preposition, grammatical.
This is something which has already been covered by previous few speakers, like Arpita ma'am covered it, and Sanghi ma'am was talking about it. So when we are looking at free play, I'm just putting these up in objective points and summarizing the topics we have already spoken about. Is we are actively looking at interaction of the child with the parents and the family. We are looking at non-linguistic cues which are going on. We are looking at interaction among family. What are we looking at? Why are we looking at it? And where we are going? Otherwise, the parent gets a very static kind of information, right? Where is the kid right now? And okay, what are his deficits? So getting the parent
or the developmental quotient or the social quotient. Okay. So that is how they start with the assessment, and then once that is done, either it is followed by the occupational therapist or the speech therapist, because majorly case that we see
relating with the speech apraxia. So all these things if goes hand in hand. So when you are doing the assessment and when you are doing the counseling, you have to look into the perspective of what other things are affected. So when you are doing the baseline evaluation, keep in mind that you are just going to tap all the other
because rather than occupational therapists doing it without the training, which we have done for so many years during the training also, that was a major area that we used to cover during the assessment and in therapy. So this is, I feel that we should be putting an emphasis on oromotor skills assessment of it. And this Comdale oromotor checklist is very easily available. Also, we can
need to think about before selecting a specific test for a child, or for in this there are various factors like the duration of test or the cooperation and attention that's required for the test. So when it's extremely restless child who's not ready to sit at one place, then that since a long time that we are discussing that we can do it in 2 sessions or 3 sessions or overall a period of time. Then we'll see that there are multiple domains which we want assessment tools that are available in Western population, and at the same time the other table talks very beautifully about the Indian context, and Indian tests that are available specifically for evaluating in Indian adolescent, as I was saying, the higher age, the older age. Picture that you see is again a bilingual assessment of a simple test. Now this test was actually done for a multilingual population, and that's why I thought I should be putting it here or sharing with you all. So this was this language, interestingly this test comes with children speaking with Mirpuri, Punjabi and Urdu.
Whereas a deviance is something that is complicated could be achieved first and there is no pattern. So the sequence of progression is also different, and the rate
child has already acquired the skill and has acquired it over all situations. So this no longer the situation becomes
therapy. So cumulative of 16 months after therapy, you can see the ELA has barely moved. At times there is a word or two. We are definitely struggling with gestures, and both are freely downloadable, and I will be putting these on the groups as well. These are excellent in getting the parent to understand the referential and the